More than 20 million Americans are affected by sleep apnea, and it isn't just an annoyance that interrupts your sleep. It can be dangerous. Joining us now to talk about a highly effective new treatment is Dr. Jared Shenson from the Orlando Health Cancer Institute. Thanks so much for being here with us today.
Thank you for having me.
Okay, so the sort of go-to move right now for sleep apnea is CPAP.
Yes.
That comes with a whole lot of complications. Why were we looking for something better?
Yeah, well, you know, with sleep apnea, it's a technology that's been around for a long time. The challenge is that somewhere around a third to maybe even half of all patients who get started on CPAP just can't tolerate it.
So this is an implantable device and we have it here. How does it work?
Absolutely. So this is known as a hypoglossal nerve stimulator.
Okay.
And the way it works for patients is to move the tongue out of the way when they're sleeping so that air can flow down to the lungs. The first part that I'm holding here is the battery pack or pacemaker part. And this goes underneath the chest here on the right side.
Okay.
And that's connected to two wires. This is the first wire here. This is the electrode. So this is implanted underneath the skin up here to access the nerve that moves the tongue.
So there are two incisions then, where the device actually goes and then the nerve stimulator.
That's correct.
Yes.
Exactly.
Okay.
Yep.
And then what happens with this guy?
Yes, this is the patient's remote control. So when they're ready to go to sleep at night, all they have to do is hit the big green button, and then the device will turn on once they're asleep and move the tongue out of the way.
So your whole team gets involved in this, and they actually help with the aftercare.
Correct, absolutely. So, you know, my job as a surgeon is to make sure that the device is put in as best we possibly can. But then it's up to our colleagues in sleep medicine, Dr. Ruiz and others, to help dial in the settings for these devices so that the patients can get the maximum benefit from their therapy.
So Dr. Ruiz-Rodriguez, you are sort of the before and after when it comes to this new device. This must be very exciting for you. You've been a pulmonologist and a sleep specialist basically your entire career. You know, is this the future?
It seems that it is the future because as Dr. Shenson mentioned, the CPAPs and the PAP machines have been used for the last 30 years. The technology around the device have changed, but the concept is the same. It's a flow generator, pressurize the back of the throat, and that's how it works. How can you deliver that? There's not much change in terms of how you can deliver. It's just with some sort of mass and some sort of machine that generates the flow of air. And it's not for everyone. And the fact they're going to neurostimulation to try to resolve the problem and looking out of the box to try to resolve the problem is very gratifying.
It's another reason to choose well with Orlando Health. And if you would like more information, you can visit orlandohealth.com/sleep.